10K for kids, 20K for adults, 50K VIP, and 1 million for a table. The Nsima Festival is proudly brought to you by Bethany TV for Health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for Health. Bethany TV for Health.
Welcome back from that break. This is still Bethany TV and it's Medical Mind. This is Teacher Zita together with Dr. Annabeth on the show, and we're looking at infertility. Wherever you're watching from, please keep checking on and following our programs, because Beth and Santa will come in anytime, ask you any question about the shows, about the programs running, and if you get the answers correct, you win a Christmas hamper for yourself. This is Bethany TV. Welcome back to the show. It's still infertility, and Doctor was still telling us more that we need to know about this very particular topic. Doctor, we have gone through all the illustrations. Now we want to look at the treatment. Are there possible treatments of especially one blocked tube? Let's start from there.
Yes, there are treatments. There are treatments for most of these causes of infertility.
Okay.
For the blocked tubes, it depends on the extent of the blockage.
Okay.
Some of the blockages are mild and minor. You don't have to do anything about the tube. Sometimes you advise the people to either time, or you give them some medication to increase the number of eggs to overcome the scarcity of the inability of the tube to move the eggs. So if you provide for it more eggs by stimulation, you'll be able to overcome.
Okay.
Now, in some of the cases, you have to correct the tube. You have to work on it to make it go back to the normal functioning state.
How do you do that? Through surgery?
Yeah, most times it will require some surgical intervention. Some of it may be minor, some of it may be major, depending on the problem. Currently, the recommended approach is, depending on where the blockage is, the recommended approach is to use hysteroscopy. This is a procedure which is done, some camera and the gadget is put through the cervix and you go into the womb.
Or you're able to see whatever that is
yes,
inside.
So for the blockages which are right inside the womb, you're able to unblock from inside.
Okay.
And also you could use laparoscopy, which in this case approaches through the abdomen inside. So those are procedures which are done in the theater.
Okay.
They are invasive, but not as invasive as the usual opening technique. Yeah, okay. So you do that. At some stage earlier on, before these laparoscopies and hysteroscopies became available,
okay.
we used to flash. They will do flashing of the tube.
Okay.
So the doctor would use some medication mixed with some fluid and push inside.
Okay.
And then with the hope of unblocking the tubes.
Okay.
Yeah, that's what we used to do. But now we don't do that much.
Okay.
So we now go for either hysteroscopy or laparoscopy. Yeah, if it is a blockage of tube and you want to unblock.
Okay.
But some cases are so severe that you don't need to unblock them. You have to go on and do IVF, which means instead of the sperm and the egg meeting inside the tube in the woman's body, you get them out. You get the egg out and you get the sperm out, and you make them to meet in the lab, in the specialized lab of the IVF.
Okay. Thank you, Doctor. I have a question for you, but before I ask it, there is someone who sent you here a message. He's saying, "Hi, Doctor. My 9-year-old son has small balls. I think those are testicles.
Yes.
And a very short, I think, male part. Is this a problem as far as his reproductive life is concerned? He's tall and big and looks older than his age. Will his private the private part of
will it improve?
Yes. Will it grow proportionate to his body? I think she is. Where is the name here? Grace. I think she's Grace from Makinde. And then secondly, she's saying, about myself, I'm 47 years old and still receive my periods normally. Those are 6 days. But I get these hot flashes that I call symptoms of menopause. Am I wrong to assume so? I'd like to conceive once more, but had my tubes surgically surgically blocked when I had my 4th child in 2014. Is it wise for me to have my tubes unblocked at my age?
Yeah, Grace, thank you very much for those questions.
Yes.
Yeah, starting with
the little boy.
Yes. Who has small size testicles, which is calling balls, and also I think he's describing that the penis is also small.
Very small. And
yeah, it's very small. Now, sometimes the causes of fertility issues are congenital. The person is born with it, and they may manifest in either delay in women, like for example to get into puberty. Of course, in my mind, also a boy can also have a delay to get into puberty, but also it can show as the genital structures being not developing well. Well, I'm not saying that the child has those issues, but this is a child who needs examination by the health worker.
Yes.
Both the genital examination, looking at the balls and the scrotum and the penis have to be examined, and other features of some abnormalities have to be examined, because we do have some genetic issues which affect the development of the child as a whole, and also development of their reproductive system in specific. So
thank you.
Yeah.
And then her concern about to unblock her tubes.
She wants to unblock her tube. I think again she needs to be re-evaluated so that the management plan is drawn by especially a fertility specialist. She has to sit down with a fertility specialist so that they are able to draw a plan and to give her advice on what the best approach is.
I will.
Well, at 46, it's a good sign that she's getting a period. It could be that she may still be having some reserve of eggs, but whether it is logical to unblock her tube and to allow her conceive normally, or she uses some other approach, for example IVF, has to be discussed with the doctor, because in that age range we have the risk of chromosomal or gene issues, and IVF probably will be a better option in that case, because then during IVF you can first check the genes of the embryos before you transfer. So that discussion has to be done with her doctor. Yeah, before she just rushes to try and unblock her tubes.
On her decision.
Yes.
Thank you. Yep. She's also saying, what would you advise as far as surrogacy is concerned? Please don't advise on best way forward. I need a child now. She's also thinking of surrogacy.
Yes. So yes, actually, just to explain, surrogacy is a form of fertility treatment.
Doctor, for those who don't know what surrogacy is, what is it?
That's what I'm explaining now. Surrogacy is a form of fertility treatment where another person, another woman, carries the pregnancy. Now, the basic IVF treatment involves the doctor getting out your egg and getting your husband's sperm. One day we'll talk this in details here, but get out the sperm, get the eggs, get the sperm out, and these two are made to meet in the specialized IVF lab. And then from that you actually get what we call embryos. These are real babies, and then they are put in the womb, and they can grow.
Womb of the woman? Of the mother?
Yes, of the mother. Now in surrogacy, instead of putting the embryo in the womb of the mother, for some reason we will explain, we put it now in another woman to carry.
Is it done here in Uganda?
Of course, we do it, and it's not a complicated science. We do it. We have been doing it for quite some time now.
Really?
Yes. So